So what I found is when patients use the mouth shield, it forms the seal because it's really tough to get the lip dexterity and kind of correct that habits in adults. Kids, it's pretty easy, you get it in 30 days. Adults, it's much harder to really build that up. It's also misleading because a lot of times if you lack the strength in your lips to form a lip seal, especially in women, you're gonna get Botox or lip filler because you have very thin lips. So it's confusing to me because I'd see these women with these very beautiful lips. I'm like, oh, you have great muscle, but it was all injectables. So I'm like, no wonder you can't form a seal. So it's almost just another, hiccup in the puzzle that we're trying to solve. So I love the mouth shield. Some of the feedback that I would get on that is they felt a bit claustrophobic. So we really had to focus on the nasal lavage and cleaning that nose out. Most of the time when patients have been chronic mouth breathers, they have some chronic nasal congestion. And so they've used all the things. They've used the Clear X, they've used, I don't even know all the products, right? All the over-the-counter nasal sprays and decongestants. And what's happened, because they've used those so long, they've built up a tolerance for it. So they're using it, but it doesn't actually clear up the nose. So that's one thing we love doing is finding new products. There's a new product out of Canada that's hydrochloric acid that goes in and just clears, all natural, clears that nose in a second. They throw the mouth shield in right before bed, and they have the best night's sleep they've ever had because they can reestablish it. We also make a lot of referrals to functional nutritionists who can really focus. Gluten-free, dairy-free is so trendy right now. I was gluten-free for a year, and then I went and had some testing done by a functional nutritionist. I'm actually allergic to gluten-free ingredients, so I'm chronically inflamed from eating gluten-free. How frustrating is that? I actually operate really well on like chocolate milkshakes. Dairy is a great thing for my body. So things that are trendy, there's so much information. I know, right? That's like the best day ever. There's so much information out there, and whoever's paying the most money is who gets their information heard the loudest. And so there's been such an overcorrection that a lot of times people are using this information, but it's misinformation for them specifically. So it's very simple to do a quick DNA test, inexpensive with a functional nutritionist to figure out what they need and decrease that inflammation. So that's been a lot of fun.
And part of your network that you
yeah.
That's incredible.
Yeah, the cool thing though is the functional nutritionist, you go on Instagram and you can partner with somebody, some of these influencers, and they don't even have a ton of followers, but you just search for functional nutritionist, the qualifications that they have to go through to get that certification. I went through it myself. It's intense, 200 hours. It's a bunch of tests that you have to take. So they've taken those. You can do it through Instagram. You can order, they mail you the blood test, you prick your finger, send it back in. So it doesn't have to be this traditional waiting room experience. And I think most of that patient base, the snores, skinny fit females who are exhausted at Whole Foods wearing Lululemon don't want to go to the doctor. They have to get a babysitter, they have to take their kids. So if you can mail them something, and those are the parents, those are the population that's on Instagram. So if you can mail it to them and have them come back, if you can monitor it through a digital method, they're all for it. In our office, you have to prove that we can trust you through a digital communication. Because if you're gonna advance yourself like crazy, more is better, you're gonna have to come see me. If I can trust you not to mess with it, for sure, we'll FaceTime you, you can send us a video, whatever works for you. And so patients are eager, oh no, I'll follow the rules. I'll follow the rules, so that works.